Hi team, this is Tricia Fioravanti, Senior Nurse Care Manager and member of your leadership team within the Ambulatory Care Management Department. I am here today to provide you with an overview of healthcare data and how it impacts our work. Let's begin with defining healthcare data. Healthcare data are any data related to health conditions, reproductive outcomes, causes of death, and quality of life for an individual or population. Data comes in two forms, structured and unstructured. As you can see by the picture on the screen, structured data is uniform and organized, where unstructured data lacks those same qualities. Structured data is stored in databases in a standardized format. Due to its standardization, this type of data can be easily searched, and the transfer of information between systems is effortless. Recorded information is the basis of structured data. Most structured data in healthcare comes from the electronic health record and include things such as demographics, patient problem list, medication list, allergies, vital signs, and lab results. Unstructured data is not standardized. The random or wild design of unstructured data makes it difficult to search. Unstructured data includes emails, audio recordings, images, and physician notes. Regardless of the difficulty in extracting unstructured data, it still contains important information that offers valuable insight into the quality and outcomes of healthcare. There are many sources for data. As you can see by the picture on your screen, there are several sources of healthcare data. These include the patient, claims data, pharmacy data, any type of remote or face-to-face encounter, lab information, data obtained from wearable devices, data obtained from facilities such as hospitals, health agencies such as home care or skilled nursing facilities, and senior homes, clinical research trials, and genetics. Sources of data also include administrative data, patient medical record data, patient survey data, and standardized clinical data. Administrative data is gathered from claims, encounters, enrollment, and provider systems. Common elements of administrative data include the type of service, the number of units, which could be things such as the days of service, diagnosis and procedure codes, service location, the amount billed for services, and the amount reimbursed. Advantages include the electronic availability. They are less costly in obtaining than medical record data. They are widely available, and there is a uniformity across coding systems and practices. Disadvantages of administrative data are that it contains limited clinical information, has questionable accuracy. This is due to the primary purpose is for billing, and the completeness and timeliness of information are also questionable. The use of electronic health records has increased the accessibility to a patient's medical history and care. Their wider use is expected to improve the ease and cost of using this information for reporting and quality management strategies. Advantages to patient medical record data include that they are rich in clinical detail and seen as credible by physicians. Disadvantages include the cost in obtaining patient medical record data, the complexity and time also spent in obtaining the information. Patient surveys are another important source of healthcare data. Patient surveys capture self-reported information from patients about their healthcare experiences. Topics covered include the care, service, treatment received, and perceptions regarding the outcome of care. Patient surveys are generally administered by mail, telephone, or online. Advantages of patient surveys are that they capture information directly from the patient. The survey methods are well established, and the questions are written in an understandable and relatable format. Disadvantages include, again, cost, as they are often mailed to patients, as well as the potential for misleading results due to survey administration, sampling bias, and response bias. Standardized clinical data is generated from facilities such as nursing homes or home care agencies. It includes detailed information about the status of patients at predetermined intervals. Advantages include existing data sets such as OASIS and MDS. They measure facility performance across multiple care domains as well. Disadvantages include the lack of clinical topics included in each of the data sets. Now let's take a look at big data. Big data in healthcare refers to electronic health data sets so large and complex that they are difficult or almost impossible to manage without traditional software and hardware. Nor can they be easily managed with traditional or common data management tools and methods. Big data in healthcare is overwhelming, not only because of its volume, but because of the diversity of data and of data types and the speed at which it must be managed. 5 characteristics are important in understanding big healthcare data. These are known as the 5 V's of big data. They include volume, the large quantity of data generated and analyzed; velocity, the speed at which data are generated and changed over time; variety, the fact that data is generated from many different sources simultaneously and in many different formats; veracity, the accuracy and completeness or truth of the data, or the opposite, meaning the messiness of the data; and finally, the value, the purpose for collecting, processing, and analyzing data that fulfills a defined purpose. Value also includes the question the data is expected to answer and the organization's response to the results of the analysis. HEDIS is the acronym for Healthcare Effectiveness Data and Information Set, which was developed by the National Committee for Quality Assurance. HEDIS is a comprehensive set of structuredized performance measures designed to arm consumers with a reliable comparison of health plan performance. It includes over 90 measures from 6 domains of care, including effectiveness of care, accessibility to care, experience of care, utilization of services, health plan descriptive information, and measures captured using electronic clinical database systems. HEDIS measures are used to monitor healthcare delivery, target quality improvement projects, and structure reimbursement contracts. HEDIS measures are currently used at Rochester Regional Health to assist in identifying and closing gaps in care that our patients may have. A set of selected HEDIS measures constitutes the basis for our current value-based reimbursement system based on the performance with these selected measures. As RN care managers, we intervene and support the patient towards reaching compliance with these measures through education, provider collaboration, and other resources as part of our patient's comprehensive plan of care. The literature shows that patients who meet the measure targets are more likely to experience improved health outcomes. Let's consider the HEDIS measure for compliance with beta blocker use in post-MI patients. This measure assesses adults 18 years of age and older who are hospitalized and discharged alive with a diagnosis of acute myocardial infarction and who received persistent beta blocker treatment for 6 months after discharge. Why is this important? Every 34 seconds, someone in the United States has a heart attack, and coronary artery disease remains the leading cause of death in the United States. Clinical guidelines also recommend taking a beta blocker after a heart attack to prevent another heart attack from occurring. As we know, beta blockers work by lowering the heart rate. This reduces the amount of force on the heart and blood vessels. Persistent use of a beta blocker after a heart attack can improve survival and decrease heart outcomes. Research confirms the value of this measure. In 2014, a retrospective cohort study of 8,672 post-MI patients without contraindications to beta blocker use was conducted to assess the strength of the association between adherence measures and clinical outcomes. The study used refill rates to determine medication compliance and found that adherence was associated with reductions in hospitalizations for major vascular events and mortality. A similar study published just this year reported that the rate of cardiovascular events was significantly higher in patients with low medication adherence as compared to high adherers, with a decrease of 50% from 12.8 to 6.4%. This is why it is important that we keep our eye out on quality metrics when working with our patients. Improving our patients' health by way of knowledge of their current status on measures can assist us in reducing unnecessary utilization, decreasing readmission rates, as well as overall healthcare costs. The extraction, sorting, filtering, and analysis of data provide us with new knowledge about the way care is provided. The patterns, trends, and associations that are revealed help target improvement strategies across the health system that impact outcomes, improve quality, and decrease healthcare costs. Big data assists in the identification of high-risk patients, prevention of medication errors, reduction in fraud, waste, and abuse, and also helps to save lives. Big data saves lives from things such as pharmaceutical databases, which ease the identification and notification of patients that were prescribed recalled drugs. The HEDIS database that we previously discussed identifies patients with gaps in care, such as preventative health measures like colorectal cancer screening and mammography, where we know early detection saves lives. The outcomes of big data are consistent with the Triple Aim initiatives as discussed throughout this presentation. Quality, safety, and outcomes are improved when data is applied to healthcare. Reduced healthcare cost is also realized through decreased utilization of services, improved provider performance, proactive as opposed to reactive care, decreased utilization of services, including hospital readmissions. As I conclude, I would like to share my references with you. If you would like a copy or have any additional questions, please reach out to me directly. And I'll just move myself here so you can get a good glance. I hope you found this presentation helpful in understanding the importance of data and how it helps to drive our work in care management and can impact safety, quality, and outcomes. Thank you for your time. Have a great day.